Thank you very much. Can you hear me?
We can.
Okay, and can you see the slides?
Yes, the first slide.
Okay, thank you very much. Well, first of all, thanks for inviting me to participate in this workshop, and special thanks also to Professor Bernardes for thinking about our group. We are from the University of Santiago de Compostela in the northwest part of Spain, and well, this was supposed to be the last talk of the workshop, and this won't be a technical talk. These other previous sessions and some of the sessions from yesterday that I could follow on YouTube. But I wanted to take this opportunity to tell you how cooperation in science can first help us being listened by authorities, and second, how can this cooperation let us to contribute and to collaborate in understanding what is really happening and how this situation may evolve. So I will talk mainly about a cooperative approach followed in Spain in the mathematical community. So if we recall how all this began, the first cases were reported in China in December, but I must confess, as already has been mentioned by Wesley, that actually in Spain, at least in Spain, we didn't see this as a possible threat to our lives until the first cases appeared in Italy. Okay, so China was far away, so everyone was more or less calm. And in Italy confirms the first case, the 31st of January. And then just in 1 month, you can see that they reached 2,000 cases, 22 deaf people. The 8th of March, there was a decree with the lockdown of the North region. And just the 9th of March, there was a global lockdown in the country. Okay, well, in Spain, the situation was the following. Spain confirms the first case also the 31st of January, but it was found in La Gomera in the Canary Island, okay, just in the island, so not in the peninsula. It was isolated, small island, so everyone was quiet at that time. The first death was on the 13th of February, but it was not confirmed until a month later. But everything started to exploit at the end of February. 5 cases on the 24th, imported from Italy, but on the 26th, we found the first local contagion, okay? And then on the 29th, 50 cases, 1st of March, 83 cases. Since the 14th of March, we have been under a lockdown, and we will continue for some weeks more with different types of restrictions, okay? Well, data from yesterday, 177,000 cases. Today, I think that 500 more deaths. This is the 18th percentage of the cases in Europe. And we have more than 18,000 deaths. And this is clearly underreported. I will tell you about this later. And something that has to be also taken into account is that 85% of these deaths happen in people who are older than 70 years old. So we have a serious problem at nursing homes. Okay. Well, some of the things that I'm going to mention were already mentioned by Wesley, and I could also give you some information about this data and quite a few more things. Well, what happened at this time with mathematicians? What we were doing? Well, at that point, we were sent home. Okay, professors and researchers, and actually, there was a lot of people working, just trying to explain the classical models, visualizing data, doing predictions. The group from Zaragoza, where Wesley is collaborating now. This was a big deal in Spain. They were in all the media, and they were like the first ones, I should say, just saying, okay, we can say something about this. There was a lot of people working, and somehow in a natural way, a community created through social networks. Okay, but at this point is where some organization appears. And I think that was a crucial point, because the CIMAT took the floor, and the CIMAT is the Spanish Committee of Mathematics. Okay, and on the 16th of March, okay, we were on lockdown on the 14th, so on the 16th of March, on the 15th of March, the 16th, they make an open call to all the mathematical community, just asking us to explain our contributions and to say, okay, we can contribute, we can put our analysis and modeling skills to the service of the society and help to create a better understanding of the COVID pandemic. The CIMAT in Spain, the Spanish Committee of Mathematics, is the responsible institution for all the actions coordinated with the International Mathematical Union. So in principle, it should be, it's an institution, yes, with a more international view. But this institution is formed by representatives of all the mathematical scientific associations. So the Spanish Mathematical Society, the Statistical Society, the Society of Applied Mathematics. So, all the fields were together there. The representatives of all the associations were there. And how did they organize this call? Well, they launched an initiative which is called the Axiom Mathematica contra el coronavirus, a mathematical action against coronavirus. And they started just contacting all the community, researchers, professors, PhD, master's students, through scientific communities, through faculties, departments, universities, research institutes. And they asked, first, they started just collecting links and contributions of the Spanish mathematical community about our research on the virus. They asked us to send all these. They collected these, and it's available on the website. But at the same time, they were promoting the discussion of within the community, and they were encouraging us to explain, to say, okay, what can you do? Okay, what else can you do to help in better understanding this situation? From the CIMAT, they name also a committee of experts who is doing a great job from the first moment, and they are working really, really hard. So the CIMAT sends this call to all the mathematical community on the 16th of March. They gave us something like 3 or 4 days to report, to say what we are doing, what else can we do. And on the 26th of March, the committee of experts prepare a proposal, a report, saying, okay, these are our capacities, this is all what we can do. And they sent this to the government, okay, and to all the regional authorities, saying, okay, we are here, we can do this, we can help you with this. Well, the big surprise here is, you may think, okay, and the story finished here. All of us are doing things, and we produce a fantastic report, we send it to the government, and it just stops there on a table of someone, and no one takes care. We got a positive response from the Ministry of Health, from the central government. Okay, they, in a couple of days, on the 28th, they say they were interested in the proposal of the CIMAT, and they want us to help. Okay, and not only we got this positive response saying, okay, you're very good, you can do things, but they also ask us to do some specific things. They establish some priorities, and they say, well, we want you first to help in this part, and then in this part. And so, and since then, there has been a coordination between the authorities of the ministry and the committee of experts of the CIMAT. And I should make here a parenthesis, because I've mentioned that we sent this to the government and the regional authorities. The health system in Spain is controlled by the regional authorities, by the comunidades autónomas, something that Wesley had also mentioned. Okay, the response from the central government was very positive. Okay, from the regional authorities, most of them didn't reply. Some of them say, okay, we are interested in this, but not in a national initiative, so we just trust our local research groups, okay? And others even say, okay, we just trust our research groups, like this happens here in Galicia, but you have to sign all kinds of non-disclosure agreements with the data. Okay, they don't want to release the data. Okay, they are obliged to provide data about cases, about intensive care unit patients. I will mention this later. About deaths and about hospital discharges, but they have much more data that they are not obliged to give it to the ministry, so they don't make it public yet. Well, in any case, we got this positive response from the ministry, and during this period, okay, thanks to the work of groups like the one that Wesley collaborated with, we were on the media. Okay, we got a lot of attention from the media. So the first task that the committee of experts required us to do, make a next call, was to work on a cooperative predictor. Okay, from the ministry they say that the immediate urgency was to have short-term predictions, just short-term so far, about cases, new cases, hospitalizations and hospitalization discharges, and patients requiring intensive care, and also deaths. Okay. For that, there has been a lot of people already working. So the idea from the CMAT was, okay, we have different methods from mathematical analysis, applied maths, statistics. So let's go for a cooperative predictor. Let's try to do some combination of all the predictions that we are getting. For running this, the government is releasing data every morning. Okay, these data are reported in these PDF files, that, like the one you can see here, but we have also the data accessible to one of the Instituto de Salud Carlos III, and there are also a lot of people who is making a great effort in putting this data ready to work with them. Okay, we got the data at 11. We are required to send our predictions, I think, before 5 in the afternoon. And there's a group that coordinates everything and predicts the final output in the evening, and this is sent to the ministry. And our predictions are 1 week, for 1 week, okay? So just for 7 days, the short term. So right now, we are 37 groups from different areas collaborating on this. And you can see the results and the different methodologies and the different approaches, and also the strategies for combination that are being followed in this website. Okay. This is everything is public, so you can check data, the predictions, and all the reports. Well, one of the groups that is involved in this initiative is the one I collaborate with, and jointly with the group from Italy, the Stat Group 19. I will tell you a bit later about them, and also with a former PhD student, José Mijeras, which is currently in KU Leuven in Belgium. Okay. Well, if you remember, when I mentioned how all this began, Italy is more or less a week ahead of Spain in the evolution of this pandemic. Okay, so in this process, the STAT group, which is formed by the group of statisticians from different universities in Italy, they had been already working in different models and how to predict the evolution in short term. Okay, prediction of the evolution in Italy, and they had already tried different approaches that were somehow tested in Italy. We knew that the type of methods that they were using were giving them good results, and well, also accounting for the differences that you have in Italy and you have also in Spain across regions. Okay, the structure and the economy in the north part is not the same as in the south part of the region. I won't put a formula. I just will tell you that we ended up using a not very sophisticated model, which is a generalized logistic model for count variables, suitably adapted in order to be able to capture not only a single peak, but a second peak or a third peak. And the interesting part of this model is that it allows us to identify two crucial values that are informative for the authorities. One is the inflection point, okay, at which point we started to slow down the rhythm of increasing in deaths in cases. So this somehow reflects if the measurements that we are taking are working or not. And then the asymptote value, this maximum value that we can reach, which is really important, as Wesley already showed, for predicting the need of resources, as it happens in intensive care units. This asymptote value, as I mentioned, what's really important for the intensive care units. Must say that our experience with the Spanish data was really frustrating. I will tell you later why. But we had very nice recomporting experience here in Galicia, because we worked locally with our health areas, helping them in predict how many resources would they need and how could they adapt so that the system did not collapse. And actually here it did not. They don't need that many time with predictions for 3, 4, 5 days. They were able to have the situation under control, which was pretty good, at least in Galicia. It was not this was not the rule for Spain. Okay, I will tell you later about this. Why I'm talking about this? Well, because you can see what we have done in the Shiny app. So you can check how this model works and how it would work for you, for Brazil, or for any other country. We have data for different countries, for Spain, Portugal, Italy, and Belgium. These are from official sources, okay, and these are tested. We have also data from the European Center for Disease Control, which is indeed an official source, but they correct the data is with it's a day later, and somehow it's corrected. So there may be some variability there, and also from the Johns Hopkins database. We have different variables depending on the country. I have cases, new cases, hospitalization discharge, deaths, intensive care patients. You can see accumulated data, daily changes. And I think that one of the interesting parts here, just for visualization, is that you can compare the results with other regions, including the delay, including the delay in the outbreak, which is interesting for doing comparisons. If Italy is 1 week ahead of Spain, how are they evolving up to more or less the same moment of the disease spread? And you can also add, it's not included in the model, but you can see it for visualization, the date that the countries took any kind of restrictions. Okay, I will. You can see in the. I'm not showing it in the app because I was not sure it will work. So this is just in the slide. But in info, you have all the databases that we are using. You have here a summary of the inflection point, about the asymptote, some crucial data for the prediction, and here you have the numeric predictions. If you go to the plots, you assume you get the numbers and so on. Well, let me show you some interesting graphs that let us just at least to see what's happening here. I'm comparing Spain, Italy, and France. Okay, Italy. We have taken this as the reference. That's the black points, and Spain is like between 5 and 7 weeks after Italy, and France is like 10 days after Italy, but everything is aligned to be at the same moment in the process. And you can see that Spain had a higher number of deaths in this case, but it seems that it's flattening sooner. That was something that we observed also, just comparing with the results from the group from Italy. This figure is from 2 days ago. It's confirming this tendency. France should be worried about their situation because they have not taken very severe measurements, and it's not getting well. Let's say there's a lot of debate here in Spain, and maybe you know this from the news. There's a lot of debate about the measurements taken by the government. Okay, was it late to say that we should go on a lockdown? What is too strong to go on a lockdown? Okay, there's a lot of criticism about the actions, and one of the main criticisms is when we compare with Portugal. Okay, Portugal, it's a week, more or less a week after Spain. Okay, it's Italy. A week later is Spain. A week later is Portugal. Not a week, but almost. Portugal share with us the border, and there's an important working mobility, especially between the north of Portugal and Galicia. Okay, at this moment, 25% of the cases in Portugal, when in the first moment of the pandemic, 25% of the cases were imported from Spain. Okay, and at this time, 60% of the cases are concentrated in the north region. Yeah. So for Portugal, it's really important to see what's happening in Spain. So I think that it's also a challenge when we do this spatial-temporal prediction that Wesley was showing. The COVID, I don't think that's understand about administrative barriers. Okay, so we have to also to take that into account, because we know that the spread of the virus from Galicia went to the north of Portugal. Portugal decided not to go on a serious lockdown at the beginning, and they were locking the north part and some areas, and put movement restrictions and even mobility restrictions in the weekends. So the measurements taken were much more relaxed than in Spain. That was we went to a lockdown. Okay. The things that they did it quite early, let's say. But at the same time that Portugal took the decision of started imposing this kind of measurements, there was another country with the same population as Portugal, which is the Czech Republic, that also decided to put some restrictions, but they did really go on a severe lockdown. And I think that they even closed airports. I'm not sure about this, but I think that it was one of the strongest restrictions in Europe. Well, this is how Portugal is doing. This is how the Czech Republic is doing. Okay, so it's quite clear that social distancing works. Okay, but you should also know that here there was a lot of debate about, okay, why do we have to be at home and our Portuguese colleagues are, yes, they have freedom of movement, not freedom, but they didn't have these strong restrictions. Just a couple of figures that I guess that you are expecting. One is about New York City. So nothing happened in the United States until a couple of weeks ago. So this is going really fast, and this is not going well at all. And this is our prediction for Brazil. Okay, I'm sure from the talk from Servio, you have to study what's happening in your country. It's undeniable that something really bad is going to happen if the authorities don't take action on this. Okay. I should also warn you about something when you fit these models, is that if you fit this model and you get that the inflection point is today, is because you are still growing. And that's the results. I ran it a moment ago for Brazil, and it's obviously still growing. But when we fit this kind of prediction models, and that was something that America mentioned about in the previous talk, we have to be aware about all the problems that we have with the data. The first question is our data reliable? Okay, we have a problem with underreporting. Yeah, the number of one of the examples of underreporting is about the number of deaths. Okay? The number of deaths yesterday was about 18,000, but here are deaths that are produced after identifying that it's because of COVID in hospitals and by medical doctors. But in all these periods, they were not counting all the deaths in old people who died, for instance, of nursing homes. And the Ministry of Justice, who is now trying to undertake all these statistics about deaths, they think that it could be around 11,000 people just in this period, from the 1st of January until today. So it's a lot. I mean, there's a serious problem with underreporting there, and this is even worse in some communities. I mean, for instance, Madrid is concentrating more or less 50% of these cases, and this. They realized about this problem. So now they are doing tests in these nursing homes. So this puts a lot of variability in our data, because when you go to a nursing home and you pass the test and you have, imagine, 200 people who are infected, so the number of cases each day has a lot of variation. So the first thing is if our data is reliable. A number of deaths, number of cases. Mariko asked about testing. Okay, the number of tests that we are doing in Spain is not comparable at all with the tests that they are doing in the north of Europe. But we are entering a solution that I will explain at the end of the talk. Another issue is if you want to do comparisons, if you want to compare, okay, what's happened here or in other country, you have to be aware that the registration of the information may not be homogeneous across countries. When we started working with the group in Italy, we were very surprised that we have such a big number of recovered cases. Okay, I think at some point we doubled Italy in recovered cases. So, and it really didn't make sense. The key was that in Italy, recovered patient is someone who has passed a test and it's negative. Okay, and in Spain, recovered patient, it was actually a hospital discharge. Okay, you leave hospital. It was only measuring that. So it does not mean that you are recovered. Okay, and that's also important if you want to measure the times that you need hospitalization. Okay, and then this is even more. This is hard to explain how this can happen. Data may not be homogeneous a long time. About the intensive care units needs. Okay. This was very important from the ministry. They say, okay, we need to know we need to predict the intensive care units demands, and Wesley showed just in his presentation a plot. They wanted to predict this demand, also to try to allocate resources. Okay. So one of the first questions was, okay, I can tell you when you are going to pass the number of resources that you have available, but even the number of resources available, it's not known. Okay? The number of resources available was published in 2017, but in this situation, the hospitals were able to adapt surgery rooms or different areas or labs in the hospitals. They were able to transform in intensive care units. So, for instance, here in Galicia, they multiplied by 3 the available beds in intensive care units. So we don't really know the exact number of intensive care resources that we have. That's one thing. And the other thing is that when the regional authorities were sending the central government their data about how many people had required intensive care, something strange started to happen when, if you look at the data, and there was something very scary in Madrid. Okay, Madrid had reported that they had available 500 beds for unit cares. Okay, 500 in the public system, 200 in the private system, the health private hospitals, but they were not using the private hospitals. So just keep in mind that they have 500 beds. They said that they were about 1,500 patients needed intensive care, with a mean period in intensive care between 10, 12 days, which is not really clear how this is computed. So it was impossible that Madrid could attend all these people in intensive care. The next day, they say that they have 1,000 people only. And but this was supposed to be an accumulated variable, so it didn't make sense that it go down. So then they say that they were understanding it as a point variable, not as an accumulated variable. So all the data was a mess from Madrid and from other communities. So since last week, the government is not really reporting this data unless they have the security that it's well reported, or it's reported with a mark saying this is accumulated or this is pointed, and that makes our task very, 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 very difficult. Here in Galicia, we are working with intensive care demands, but with regional data just through our hospitals or regional government. And I know this is happening in other regions. Well, but apart from this, I mentioned that in our report, in the report from the CIMAT, the minister starts saying we want these short-term predictions, but then they say we want you to do more. So now last week, during last week, there was a group that was working on the simulation of different scenarios. It was the back to normal life, wherever normal means after this. They were testing the different scenarios on different types of mobility restrictions and social distances to prevent a second wave. Okay, so now they are working with that, and just to check, okay, when we can start going to work, or when kids will go back to school, and they are also using different methods and trying to put things in common. That's one of the groups. We were also called to help. This was just in a couple of days to help in a scientific search about the effect of these measurements, like using a mask or washing hands, or they wanted scientific evidence of different measurements. There's a lot of scientific literature, and we all know that you can trust some papers, but others are not really good. So we were asked for that. And this last point is it's about something that America commented. It was about the cases. Okay, and Wesley also mentioned about this the asymptomatic people. Okay, people who is infected but who don't have symptoms or very mild symptoms. Well, this was also from the report that the CIMAT produced and sent to the ministry. We suggested to do a kind of survey following a similar procedure it's done for one of the economic surveys, just to do in a two-wave survey the tests in families, at homes, in different places. I don't know how to translate that in English, but it's mostrage biotápica. So the National Institute of Statistics, jointly with the Ministry of Health, through the Instituto de Salud Carlos III, who is in charge of this, the epidemiology department, let's say, they have already started conducting this study to be able to estimate better the number of cases. Apart from this, they are doing tests in the nursing homes, because there's a specific problem there with elderly people. And just this morning, we were informed by the CIMAT that the Ministry of Science is also conforming a board of experts and they have called the president of the CIMET to think about how our research and innovation structure should be in order to confront this kind of situations quickly, okay, in order to be able to give a response. In Spain, as in other countries, as in Brazil, as in Italy, as in Portugal, the science has all the people from science have said, okay, we want to help, but we need some kind of organization. Okay. There's still a lot of work to do, and some of the issues that were already asked by the ministry, and we were seeing how to get this time of the type of data that we need. One is the spatio-temporal evolution, what Wesley has shown. It's very important to be able to put local measurements in different areas. So not to go on a global lockdown, but being able to try to control that. This is what is done in the north of Portugal, not really on a very, let's say, serious scientific basis, but they were controlling the patients one by one in the first weeks. So they knew that, okay, if I had 3 cases here, then I will isolate this council, just small villages. So they were like that. Also the incubation time. This is not clear how it's the incubation time, and we have problems for accessing the individual data for this. Okay, but there's also some interest about this, and apparently we will be able to get the data from Belgium, who is also involved in this project, and other things. It's about society excess mortality. There are some people saying, okay, this is excess mortality, or it's there's also a harvesting effect here. What's really happening? There's still a lot of work to do, and we should still be here to help. And just the message, it's just let me remind you that if we are together, our voice sounds louder, but obviously you need someone there to listen to you. And we have to say that we were really lucky, and I think that we are doing a lot of work, but I think it will be valuable. Okay, so thank you very much.
Let me do something now. Okay, Professor Rosa Crueiras, thank you very much for your very nice presentation. I think that your conclusions are very important for us in Brazil. I'd like to say, I would not like to say that we suspect that the number of deaths in Brazil are far from the number you have. I think that we are trying to obtain the real numbers of deaths by SARS here in Brazil, not for COVID, but anyway, for all types of acute syndromes, respiratory syndromes. And the real numbers are higher than we have, for example, in the Johns Hopkins or other sources. And in Brazil, we have estimators from 8 to 12 times the number of infected people and the number of hospitalizations, and probably we don't really know the number of deaths. I think that's, we tested, I don't know if all of you know, but in Brazil, the tests for million of inhabitants is about 300 tests for million. For example, in Spain, it's 8,000. In the other countries, it's about 20,000. No, and that is a very, very serious problem we have here. We have time for questions or comments, and if you have comments.
I have a quick comment.
Who is
congrats, Askeri.
Okay, Askeri, please.
Yeah. So thank you for the talk, and congrats for the job. It's a really good job. Here in Brazil, we have difficult to explain why physicists and mathematicians involved with those kind of. Yesterday, I had to explain that physicists we study the collection of a great number of interacting particles, and we write down equations, and it's why physicists and mathematicians suitable somehow to try to find some unknown answers yet. And I would like you to tell a clear message. Maybe many people are watching now, or they will eventually watch this, because when someone from Italy, Spain, China, they talk about the situation, the real situation, it's the message is somehow more clear to the people here in Brazil. When we talk, it's not the same effect. So if you could tell us the key elements of social distance, so that people can really understand that we have to stop the spread before the damage is done. Thank you.
Okay, thank you, Esri. Okay, as I mentioned in the 15th of March, was it the 15th, not the 14th, as I put, we were in a lockdown. Okay, the government, actually Spain was looking what was happening in Italy, and in Italy everything went really fast. The 8th they said we closed the north, but on the 9th they said we closed the country. Okay, it was under control. Okay, so in Spain, the first restrictions started in I think that between the 6th and the 14th of March. And, the first cases were localized in Madrid. Okay. And in the first talk, it was interesting to see how your airport network led to the spread of the disease. That was something that happened here. The first cases were in Madrid, but Madrid is connected with the whole of Spain. Okay, so they started putting some restrictions in Madrid, but here I think there was a problem that people didn't took it seriously. So they say, okay, we close universities in Madrid, and then students came back to home. Okay, the first case in Galicia was from a student who came from Madrid. I think that we should have be more strict at this first moment. Then on the 15th, we went on a lockdown, and we can see what are the effects of this. Okay, we have flattened the curve. We have helped to flatten the curve, and now the authorities are really concerned. Okay, how we go back to how we started again doing our lives. Okay, but with caution. We cannot afford a second wave. Okay, these are many deaths. So that's and we don't have enough resources. In Madrid, it was really tough. The government at some point also wanted to share resources between communities, and it just happened between two communities because of what I've mentioned before. There are also political reasons behind. I mean, and this is not good. This is about life, and science can do something. And at least we are lucky that they are listening to us. The government listen to the scientific community, not only the mathematicians, but the epidemiologists, the health scientists. Okay, so then they are putting this under control. This is hard, but the sooner you take action, okay, the better. You can see that I think that the plot from the Czech Republic is quite relevant. They went on one of the strongest lockdown in Europe. They closed everything. They stopped. Okay, and they are doing much better than any other country in Europe. Okay, so that's really important. But we can help. But we need that someone wants us to help. So I think that's the main difference between the countries. The group in Italy, I didn't mention, they were also contacted by the government, and the Italian Statistical Society is also collaborating with the national government, and it's starting also a movement in Europe through the Federation of Statistical Institutions, and also through the European Mathematical Society, to try to coordinate actions in Europe. In some cases, it will be late. Okay, but if we can help if our experience can help you or can help other countries, that will be worth it.
And thank you, Professor.
More comments? Okay, if you don't have more comments, I would like again to thank Professor Crujeras for very nice presentation and for last advice. I think that this is very important for us. And okay, there is something here. Yeah, I don't know what happened, but anyway, I thank again, and I let's see what's going on here. I have is everyone okay? And I would like, in conclusion, and we have this final. I think that this final comment from Professor Crujeras about the importance of gathering people from different scientific communities, but we need to have to be provoked by authorities. And in this way, I would like to emphasize that we have proposed in the beginning of this session to produce a letter from this meeting and to address this letter to authorities and to other people, to politicians. And we asked about the possibility to be signed by IIP and Brazilian Society for Advancement of Science. I don't know. I think that Aldo is here, and I would like about this. And if it's okay for all, I will prepare this. We can prepare this with Álvaro and send to all the groups, the Brazilian groups of at least, and to see what can happen. I don't know if someone want to give more comments or something like this. And
yes, Américo, I would just like to comment that this conference was very important. It's very important to know the information and to know the situation from different countries. We have to learn from their experience. It's very important to produce. In Brazil, we have this peculiar situation in which scientists are not heard from the authorities. But it's our duty to make them know what the situation is. We have to communicate, to improve our communication directly to the Brazilian people as well. So we have to produce these documents, send the documents to the Congress, send the documents to the authorities, federal authorities, to the local authorities. In the Northeast, there is the Science Commission, which is giving advice to the governors. This is a very good thing. We should try to do the same at the federal level as well. So it's very important that we just tell them the facts, that what are the real numbers about everything and what are the consequences if they do the irresponsible move to relax this social distancing policy. This would not be acceptable at all. The consequences would be tremendous. And it's very important that we really produce this document with many facts, all the numbers, no ideology. We don't care about ideology. We just have to produce the facts. So taking this opportunity, I want to thank all the speakers. You've done a tremendously good job. Today's talks are very nice as well. Rosa, Wesley, everybody who presented their data to us. Servio also had this good idea to convince us to produce the letter. I think we should do it immediately. And finally, I want to thank you, Americo, to come up with the idea to produce the meeting in the first place. And I'm really glad that we did it. I'm very happy with the outcome of all this. So thank you very much, everybody, and congratulations, Americo, for the very good work you did.
Okay, I think that's not okay. Many people gave this kind of idea. Maybe I have the privilege to have the contact with direct contact with Alvaro, but I think that's not it is not the important thing. The important thing that we get the people. We have a lot of material, a lot of presentations. Some speakers already sent the presentations. I ask again all the speakers if they can send the presentations. The videos are available. I think that we have to start now a kind of communication. It's very important to have the communicators, this kind of people, the YouTubers, the scientific YouTubers, or this kind of people sharing the videos and the presentations. We will do it. And okay. Finally, I thank again the speakers, all the speakers, for sharing the work with us. And I thank Alvaro and the team of IIP, because I think that some people which does not appear here, but they Valdelino, Juliano, Silvio, people who work a lot and still working to provide the conditions to us to have this conference. We organized this in few days. I think that is the fastest conference IAP organized in its history. And I think that the IAP team, I don't know all the numbers, all the names, sorry, but I think that they have a very good job. And we are learning how to do this kind of virtual conferences, but I think that it worked very well. I think that the result is very good. Thank you very much. And okay, keep safe. Thank you very much.
Thank you.
Thank you.
All the best.
Thank you. Americo, bye. Bye-bye. See you.
Bye.